Malaria continues to pose severe threats in Sierra Leone and sub-Saharan Africa. The commemoration of World Malaria Day in Sierra Leone witnessed the official rollout of the malaria vaccine. As vaccines for this deadly disease are being introduced, particularly for vulnerable infants, President Bio takes pride in Sierra Leone being among the first countries to include malaria vaccines in its immunization programs.
Last year, we were privileged to be the second country in Africa, outside the PALO countries, to receive 550,000 doses of the vaccine. We shall initially target 286,253 children under 2 years in 15 districts. The 15 districts were selected based on their moderate and high malaria prevalence rates. On this World Malaria Day, the government and the people of Sierra Leone reaffirm our unwavering commitment to control and ultimately eradicate malaria in Sierra Leone. Let us continue to march forward with determination, compassion, and solidarity until we can proudly declare that malaria is no longer a threat to children.
Malaria is a leading cause of deaths and hospital admissions in Sierra Leone every year.
Specifically, the disease accounts for 40.3% of outpatient attendance for all ages and 37.6% of hospitalized cases. Over the last 6 years, my government has made significant progress in instituting nationwide malaria control and prevention measures, including 1. High-quality free diagnostic testing and treatment for malaria at the 1,500 public health facilities around the country. 2. Insecticide-treated bed nets distributed free of charge to children under age 1 during immunization services and pregnant mothers attending antenatal clinics.
The government of Sierra Leone's payments for vaccine co-financing was a significant factor considered by Gavi for the vaccine supply, which is procured and delivered by UNICEF in mid-December last year, with funding from Gavi and technical support from WHO.
The launch of the malaria vaccine into the routine immunization services marks a laudable venture, ensuring that every child between the ages of 6 to 23 months old have access to this life-saving intervention. This initiative underscores the commitment to achieving universal health coverage and reflects our resolve to leave no child behind.
The malaria vaccines have been deemed safe by WHO, UN, UNICEF, Sierra Leone's Pharmacy Board, and National Immunization Technical Advisory Group. The U.S. Ambassador to Sierra Leone also pledged support in the fight against malaria.
Today, the United States reaffirms our commitment to ending malaria in Sierra Leone as a partner to the government and people of this country. The United States will continue to support wide-ranging efforts to reach zero malaria by investing an additional $16 million this year in Sierra Leone.
The vaccines are co-funded by the Sierra Leonean government and development partners, with Sierra Leone contributing $1 million. President Bio highlighted that their interventions have significantly reduced malaria cases among children under 5.
From 1,032 in 2019 to 7,754 per 1,000 in 2023, representing 27% reduction in case incidence. Also, we have seen a reduction in inpatient death from 732 to 84 per 1,000 children in 2023, representing a whopping 89% reduction in inpatient malaria death rate among children under 5 years. Through our excellent collaboration with Gavi and partners, my government has been allocated 1,443,950 doses of malaria vaccines for the year 2024, for the period 2024-2025.
Citizens are urged to remain vigilant by implementing existing malaria control measures, such as sleeping under treated mosquito nets, pregnant women and children receiving intermittent malaria treatment, infants receiving 4 doses of the malaria vaccine starting at 6 months old, and maintaining a clean environment. Salifu Charna Kamara, AYV News.